Wakubwa kabla mchoke. Kamera.
Kimbia.
David Anakealila. I'm the Chief of Some Medical Services. Today we are here. We want to advocate for the end of PPH, especially in Kakamega country. I know the event is taking place all across the country, and our doctors, led by Dr. Mtaha, has organized this event to be in Kakamega, and that's a plus for us. As we advocate for the end of PPH, we are also going around to make sure that there's enough blood through blood donation. We know that PPH has been common around Kakamega. I've experienced most of our mothers losing life because of PPH, but there are several initiatives that we put in place. One, we bought the NASG for the mothers to prevent that, capetocin drug, and when procurement is being done, I make sure that I cannot approve any procurement when these commodities are not there. And for us to be able to alleviate and protect mothers, especially in the maternity, the county government is going to employ more health workers, especially nurses, the AMOs who are going to support our consultants in the maternity and to end this. I have an initiative which I've shared, I think, with Dr. Mutaha, that we come up with a committee so that we make sure that there's zero maternal death, which is, of course, emanating from the PPH. What we've done is that this committee will have something like telemedicine, where our OBS, who are the main consultants here, are able to guide all the other MOs in level 4 facilities so that we don't have maternal death. But we are determined as a county, led by His Excellency the Governor, to make sure that we end the death of our mothers when giving birth, especially through PPH. I know that the common one is the one we call TON, isn't it? Uterine atony. That's the most common one here. I've have an experience of one that I attended in Matungu at night, where a mother bled to death. It was so traumatizing to me, and I think that this has to come to an end.
Mohanda, the Chief Officer Public Health for Kakamega County. We are pleased to be here as a department to advocate for ending postpartum hemorrhage. We know this is a big challenge, and because this county is well covered with the community health strategy, that is community health promoters, we have 4,250, and as we know, some of these mothers die as a result of fast delay in the community. We want to advocate to the public, the community, that every mother who is pregnant is supposed to visit our health facilities as early as she recognizes that she is pregnant, because we are encouraging them to come to our facilities for the eight visits. And therefore I want to appeal to all community health promoters to map out all pregnant women in the community and be able to link them to their link facilities for prompt management. We want to request that those that cannot be able to reach the facilities, they also link up with their community health assistants for support. We want to appreciate that the county, through medical services chief, has put in measures to procure even commodities. Thank you.
What is the rate of delivery facilities?
This one will.
County General.
My name is Beverly Wambani, and I coordinate reproductive and maternal health services in Kakamega County. And today I'm very much pleased, very much happy for the organizers of this day. We are all running for her, we are running for this mother, because postpartum hemorrhage is a major killer of our maternal death that are reported in this Kakamega County. And with this day, I'm sure that by the end of the day, at least everybody will know that we are really all advocating and that we must team up to end this postpartum hemorrhage in the county. Yes, currently with the outcry that is there, I really want to appreciate the leadership of our county government of Kakamega, led by Dr. David Alila, whereby there are many innovative ways that we want to prevent this postpartum hemorrhage with. And first of all, we are talking of NASG. NASG is a pneumatic anti-shock garment, whereby if you diagnose that a mother has started bleeding, you tie this mother before you escalate to the next level. So Dr. Alila has ensured that all facilities must at least have these two NASGs in their facilities. Then again, we also have drugs that we use to control this PPH. So our medical officer, our chief officer medical services has ensured that in the facility improvement fund that the facility charges are receiving, 30% must all go to the commodities, and among the commodities are the drugs to control PPH.
Maybe what is the mortality rate PPH?
Post PPH, I will say that it's around 50% of all the maternal mortalities in Kakamega County. And entirely we are at around 180% of 100,000 live births. We are actually, there is a drop compared to the previous years, and we are sure that with this many advocacy, we are on the course of reducing these maternal mortalities. And we also want to appreciate, we have partners on board. We have partners like Luala Community Health Alliance, we have LifeNet International, and many other partners together with our obstetricians, whom together we are working to ensure that we are controlling this postpartum hemorrhage and reducing the preventable maternal mortalities. Thank you.
So welcome. We are here to the End PPH initiative, and this is the second run that we are holding in this country. So postpartum hemorrhage is excessive bleeding after childbirth, and it's the leading cause of maternal deaths in Kenya. So each year we estimate that about 2,000 to 3,000 mothers lose lives to PPH, and these deaths are often preventable. And we know that when a mother dies, the entire family and communities are left grieving, and children grow without other mothers, and households are torn apart. So every newborn deserves to have a mother. That's our call. We believe that the mother is the pillar of family and society, and her loss has devastating multi-generational consequences, perpetuating a cycle of poverty. We want every mother to go home healthy and have a happy and healthy baby. If I'll quote the late Prophet Muhammad Fala, a former president of FIGO, said, "Women are not dying because of diseases we cannot treat, but they're dying because society has yet to decide whether lives are worth saving." And how do we decide that? That we know that postpartum hemorrhage is the leading cause of maternal deaths. So how do we prevent? Is to put up measures that will help to prevent postpartum hemorrhage, or to treat mothers who suffer from postpartum hemorrhage. How do we do that? We ensure that there are enough supplies. We ensure that we have enough blood products. We ensure that we have critical care services within our counties. And we ensure that maternal health is accessible to everyone. As it is, we know what is happening right now. We know that there are mothers who are denied exit from hospital after delivery because they are not able to afford the bills. We know previously we had Linda Mama, now we have SHA. SHA does not recognize underage mothers. So when an underage mother delivers in the hospital, how do they live? Because they are registered under their parents. If they are registered under their parents, then they are not able to register on their own. What happens? Their bills cannot be taken care of. So those are the things we are talking about. Can we ensure that our systems are able to address that? Can we ensure that we are able to take care of the needs of the most vulnerable people who are not able to take care of their bills? Can we ensure that we have enough blood products? Can we ensure that we have critical care services? Because that's what is killing most of our people. Some of the counties that we have in Western Kenya, in this era of devolution, still do not have critical care services. Yet we know that in the COVID era, there was money that was distributed along to provide critical care services to mothers or everyone who needed the critical care services. So our mission as PPH is a collaborative initiative between the University of Nairobi, Kenya Obstetric and Gynecological Society, Midwives Association of Kenya, and the PPH our foundation. Our goal is advocacy and community engagement, research, evidence and skill building, innovative health system strengthening, data and ecosystem development. So we believe that this multi-sectoral approach is to create lasting impact from communities and level national and global. So the PPH Run, which is our flagship advocacy project, the motto is raising voices to save lives and aims to build awareness and rally public support. So we had an inaugural run that took place in October 6, 2024 at Ulinzi Sports Complex in Nairobi. It attracted almost 3,000 registrants from more than 300 organizations and institutions across 20 sectors and 30 countries. So nearly 1,000 people took part in the physical participation. So following the success, that's why we have this run, and we intend that to make it continuous. And we'll have a global event like today. It's happening across 7 counties, Kakamega being one of them. The main event in this country is happening in Ulinzi Sports Ground in Nairobi. We also have one in Kwenye, Kajiado, Mombasa, among other countries. We also have one happening in Rwanda, Nairobi, and Tanzania today. So we also give thanks to all our supporters, our partners who have been with us. We give thanks to our main sponsors, the COGS, Midwives Association of Kenya, and the Ministry of Health. Our national organizing committee led by Dr. Kireki Omanwa, Professor Ann Beatrice Kihara, who is the FIGO president, and our local organizing committee led by Ebi Shisia, who is our treasurer, Dr. Godfrey Mtaha, who is our chairperson, and the many people who have taken part to make sure that this event is successful.
Dr. Mtaha, and I'm the chair for this committee that is planning this run. I think my colleagues and my seniors have already talked much, but our aim is to reduce maternal mortality and morbidity in relation to postpartum hemorrhage. We want to make sure that our children have their mothers, our fathers have their wives, so that they don't suffer from postpartum hemorrhage. So today we are welcoming you here so that we can be able to donate blood and advocate for this postpartum hemorrhage. Thank you.
Thank you. My name is Nyumbile Boniface. I'm a consultant pediatrician. I stand with COGS and the entire team of partners in advocating for ending to PPH. It feels bad as a pediatrician when you go to do a ward round in the newborn unit and you are told that this mother is not here. She passed on during delivery because of excessive bleeding. So as Kenya Pediatric Association, we stand with the COGS and the other partners in this run and advocacy so that each one of us come out, donate blood. Both county and national governments stand with us, they understand and come up with policies that will ensure that we reduce this maternal mortality due to PPH. It's a significant cause, and over years we've struggled both nationally and internationally to end it. So I stand with my colleagues from the reproductive health team, and pediatricians believe that a healthy mother means a healthy baby and therefore a healthy population. Thank you. Thank you.
It's Mumin Ama. I'm a nurse by profession and a midwife with passion. I'm a survivor of PPH. In 2015, if I can give a brief history of my experience, it was my last baby whom we had to go for elective CS. And this the day now, as you prepare around 3:30, I was admitted for pre-op. But now the theater was so busy, and with one team running, with one MO, I was to be taken to theater at 5 a.m. But it didn't occur because of few logistics that needed some CSS to be utilized for sterilization before I was taken in. Because of emergencies, now that I was elective, I had to wait up to 11 the following day. So when I was taken in, intubation was a bit difficult, but they tried, but it did not make up. So with the difficult intubation, I remember personally being cut with pain, but because the body was paralyzed, I could feel the surgical blade, but I couldn't move. It was an ordeal that it was not easy. But I thank God, before the surgery, I was allowed to pray. And I remember one thing, that in everything give thanks. So I did a prayer with the Dr. Ekesa and the Sister Faith. Abineri was my scrub nurse. But I remember telling my anesthetist, how is the blood pressure? How is my malambati? Because my malambati means you are coming in to be assessed before you go to theater if you are fit for surgery. I was not able to be done spinal because my back had an issue. So I was given the GA. It complicated. I remember after surgery, my husband telling me that I had died, and even the team went to condole with him and just encourage him that yes, the baby made it, but we have lost the mom. But there is this unique anesthetist, Dr. Paul, whom the team shared with me later on that he never gave up on me. He kept on bagging that bag for oxygen. When they had the body cough, they ran back again to do active CPR. So again, I was resuscitated, and even after bleeding excessively, there is this thing that they do to mothers, bilge. The doctor was able to arrest the bleeder using a procedure called bilge, because my uterus was not contracting. It was in atony. So I bled excessively, but I thank God the team did not give up on me. As a nurse today, I'm running for her, because even at facility we thank the government of Kakamega with FIF allocation is able to give mothers a chance, because 30% that goes to drug, we have hit capsaicin, oxytocin, and even we have NAS-G, we have UBTs at facility that are able to support and prevent mothers. So today I'm here as a living testimony that yes, many deaths that have occurred in Kakamega, still there are those that are surviving. There are those who have survived like me, and let us keep the pace. Let us run for her. Let us make logistics available. Ambulances, kindly, if we can run with ambulances to be restored, we will save many lives. Thank you.